So we're going to talk about the coccyx. And this little bone right here, we're going to talk about why you would ever consider treating it. And there are several reasons. So hopefully they will be enough to get you, especially with your lower quadrant patients, to at least assess and see if the coccyx could be contributing to what's going on. So what are the reasons that we look at the coccyx? The first and the most obvious, and the reason that the most physical therapists in this world would agree with, is any amount of hard tailbone falls, blunt kind of trauma to this area can cause the coccyx to get fixated in different positions. And if it's fixated in different positions, then it can contribute to a lot of different neurofascial issues that just cause your body to recruit and move differently than it otherwise would, which can create issues throughout, especially the lower quadrant, beyond just tailbone pain itself. Okay, so trauma is the first thing. The second thing is we have the brain, we have the spinal cord, we have the dura, the skin of the brain and the spinal cord, that has attachments onto the sacrococcygeal junction. Okay, so if there's tension in that dural system, and that dural, we call it the dural tube, if there's tension in that dural tube, then the coccyx can be pulled and fixated in different positions, in which case, oftentimes to get that dural tube restriction to let go, we work on mobilizing the coccyx, and it's pretty amazing actually how the dural tube will actually free up as well. All right, another consideration is visceral restrictions, right? So different restrictions in the viscera, especially in our abdomen, can cause tension and pull onto our coccyx. And part of getting some of that visceral tension to let go is actually to work on where it's pulling onto. So working on the viscera, but then also working on the coccyx as well. Next, we have just the neurofascial, well, I'll say neurofascial. Well, let's just say fascial restriction from Tom Meyer's work of anatomy trains. Okay, so we have all these different fascial lines that connect our upper body to our lower body, and a big area where some of these lines cross over each other is in the area of this coccyx. So he'll talk about like the anatomy trains, but then like some of the train stations where there's overlap of some of the lines can be really important areas to work on and see if there's this dysfunction. So the coccyx, the sacrum in this area is a really important thing to look at. Okay, along a similar line of both of those is just general neural tension as well. So you can have the fascial restriction, but then you can actually have neural tension, may or may not be coming from the dural tube, but if there's lower quadrant neural tension, it could be pulling on the coccyx as well. Okay, so these are all things to think about: trauma, visceral restrictions, anatomy trains like fascial restriction, neural tension. And then the last thing that I think I would at least like to mention is the muscles that attach in this area are the pelvic floor muscles, and even like glute max as well. And so you can imagine with some of the pelvic floor muscles, I'll kind of turn this way. If you imagine some of the pelvic floor muscles, if you are excessively tight on one side and relatively loose on the other, it can pull the coccyx off one direction or another. If you're overall just not contracting well, it can cause the coccyx to move too much. And if you're over contracting, it can cause the coccyx to become fixated in the pelvic floor area. Okay, so it's not, with pelvic floor clients, it's not just working on all the soft tissues around the coccyx. That's important, but it's also, you want to work on the potential for fixation of the coccyx itself. And we'll go over all the different potential ways that it could be fixated in another video. But this is just general overview, why you would ever look at the coccyx. Hopefully this helps convince you that it's worth taking a look at.